common words and phrases that are used in pregnancy that we need to master. Okay, because a lot of these words at times confuse a lot of candidates. So mastering common words and phrases used in pregnancy. So you need to know the difference between these two words. When the NCLEX says gravida and when the NCLEX says gravidity, two different things altogether. So gravida basically means a pregnant woman, pregnant patient. Gravidity rather refers to the number of pregnancies. So if I say this is a gravida, a gravid patient, that means the patient is pregnant. But if I say, she's gravida 5, that means she's been pregnant 5 times. That's all. So gravida means pregnant patient. Gravidity is the number of pregnancies. Let me move on. There are also 3 definitions we also need to learn. Nulli gravida, primigravida, and multigravida. Most of the time, I see a lot of NCLEX candidates confusing nulli gravida and primigravida. So let's take our time and understand it. So nulli gravida means the patient has never been pregnant. Never, ever, ever been pregnant. Primigravida is the first pregnancy of that patient. Primigravida, nulli gravida, null hypothesis, no null, nil, 2-0, nothing, right? Primigravida means the first pregnancy, and multigravida means 2 or more pregnancies. Okay, 2 or more pregnancies. So nulli gravida means the patient has never been pregnant. Primigravida means the first pregnancy, and multigravida means 2 or more pregnancies. And another definition we also have to learn is what we call parity. Parity. So para is the number of infants which are delivered after 20 weeks. After 20 weeks. After 20 weeks, that's parity. Okay? And whether they are born dead or alive, so far as they are born after 20 weeks, you add them to the parity. Now, what about if one pregnancy contains 2 babies or 3 babies or 4 babies? You still count it as 1. Even if the pregnancy contains 2 babies, 3 babies, 4 babies, or even 5 babies, quintuplets, it is still considered as 1, regardless of the number of babies in the uterus at a time. So you can have 2 patients coming to you for an assessment. One is carrying a single baby, one is carrying 2 babies. They are still considered 1. So I have a question. If you have a patient who is coming to you and has never been pregnant before, how will you classify that patient? Can someone either say it or text it? How will you classify that patient? Never been pregnant before. Patient who has never been pregnant before. How will you classify that patient? A, multigravida. B, primigravida. C, nulligravida. Okay, good. I've seen Olimade and then Risikat say nulligravida. Beautiful. Now, what about a patient who is carrying twins? Will you consider that parity as more than one parity or single parity? So it's just one parity, right? Okay, good. So let's move on. Now, in order to be able to understand all these things, you guys have to use the acronym GTPAL. 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 Your PAL in GTPAL. So G stands for the gravidity, the number of pregnancies. The T is the number of term infants who are born after 37 weeks, 37 completed weeks. And then P is the number of preterm infants who are born between 20 and 37 weeks, right? And then A stands for the number of pregnancies ending in spontaneous or therapeutic abortion. So T is if the babies were born after 37 completed weeks. P is if they were born between 20 and 37 weeks. And then A is those pregnancies which were lost before 20 weeks, GTPAL. And L is the number of living children. The number of living children. So I want to ask a question. Let me share my screen, the whiteboard, and then let's learn something. Then L3, can someone interpret this for me, please? I'm making it big. What does this mean? Anyone, please? Anyone?
Yeah, so the G6 means the patient has had 6 pregnancy in total, and T means that the patients had 2 infants born to term after 37 weeks. And the P means that the patient has 2 um, pregnancies born between 20 weeks and 37 weeks. And the A means patient had 1 spontaneous for therapeutic abortion just before 20 weeks. And the L means that these patients had 3 living children out of the 6 total pregnancies.
Exactly. Beautiful. Beautiful. Done so beautifully. Done so beautifully. You have arrived in glory. That's beautiful. So that is it. That is it.